Welcome. This session looks at the work of one of our charter champions, the Kolkata Gynae-Oncology Trials Group, KolgaTrug as I call it, in collaboration with their patient group Sarbajaya, and the work that they are undertaking to raise awareness and introduce genetic counselling and testing into the communities of Eastern India and Nepal. The programme is called NuGenA and aims to identify families at risk of developing ovarian and breast cancer with a view to prevention and early detection. I'm delighted to be joined by lots of the team, and we'll hear from lead nurse Dona Chakraborty, Dr. Puja Chatterjee, and ovarian cancer survivor Dona Chakraborty as well. But first, to tell us how the concept came about, is Dr. Asima Mukhopadhyay, who has led this work. Welcome, Asima. How did the concept come about?
One of the things when I was doing my research projects in ovarian cancer in India struck me the very high incidence of BRCA mutations in our patients, around about 30%. But what I thought was the gap in that while we were detecting or sending patients for some genetic testing with some problem, when the problem was to follow up the patients. And so I just thought the missing link was because the doctors didn't have enough time. So we got a research nurse, one of my research nurse trained in it, and that worked. And that has led to the concept of this project. And then we got support from BARPs, one of my friends, Saranjit Manjanda, where I could send my research nurse to got training. And then, of course, we got some funding from Overcome in USA. So that was the start of these projects. And it has been a success story. And so you can now hear the rest of it from my team and the patient group, which have been absolutely brilliant in supporting this program. Thank you.
Thank you, Asima. So, Donna, I'm going to turn to you, Dona Chakraborty. You are the lead nurse on the project. And to prepare for this, you, as Asima said, you undertook training, genetic counselling training at Barts Hospital in the UK. But it was a very different challenge to get this project off the ground in India. So how did you go about it? And what did you decide was the best approach?
Well, while the concept of research nurses, the clinical nurse specialist, and genetic counselor nurses are very familiar in UK, it is a very new concept in India. So through the DSUKRI project, I got the opportunity to be trained in St. Bart's Hospital, Freeman's Hospital, and NGOC Gateshead. However, implementing the concept in India was a serious challenge for me, as most nurses didn't have any idea about my role. Initially, I had to familiarize them with my role as a genetic nurse and as a clinical nurse specialist. As they grew more familiar, they got interested in my roles and responsibilities. Every strata of nurses supported me, and every nurse felt empowered that they will be able to provide such a significant role in preventing cancers. Well, the interesting aspect about NuGenA is that it focuses on nurses. It is seen that nurses tend to be stable in their jobs as compared to doctors. Moreover, the nurses are point of contact for all patients and spend most of their time under their guidance and care. Investing in a nurse and training is quite cost-effective and scalable as well. So through NuGenA, we plan to introduce the concept of repetitive education on cancers. Patients visiting the OPDs, admitted in wards, ICU, healthy individuals visiting their primary health centers, any pregnant women visiting their community health nurses, they will all be seen and talked about cancers, and any possible case of hereditary cancer risk will be identified by the nursing personnel present. Since a large population of cancer patients catered in our center are from low socioeconomic and educational background, the awareness about cancer and cancer risk is very less. With repetitive counseling and education, the patients and their family members can be made aware about the cancer risk, and the chances that the patient identifies it and takes action about it increases more. Well, another challenge which I presume is present in almost every low middle income country is that healthy individuals are less receptive to cancer awareness as compared to the cancer survivors. Keeping this in mind, NuGenA aims to initiate the snowballing effect. That is, the patient and their family members who are affected with hereditary cancers will share their journey and the impact of genetic testing on their lives to increase awareness.
What have been some of the challenges and successes so far in rolling out this project?
Well, one of the biggest challenges which we faced was the impact of COVID-19 on our project. However, even through such constraints, we have been able to initiate 3 centers. We have been able to provide an initial training to a total of 56 nurses from India and Nepal. We have developed various education and training modules for training nurses on hereditary cancers. We have initiated counseling and patient uptake under the banner of NuGenA. Also working alongside this role, I am currently enrolled in the Masters in Genetic and Genomic Counseling program at Cardiff University, UK. Well, since the patient data got delayed due to COVID, we are working on opportunities to gather funds and revamp our work. With the initiation of the study through satisfaction and regret scale, we found that nursing counseling was more accepted by the patients, as many stated that they feel much more comfortable discussing their hereditary condition with the nurse as compared to a doctor. Surprisingly, the satisfaction score was almost 100%. Then again, we face the challenge that healthy individuals do not come for cancer screening, even if a cancer risk is found in their families. Hence, we are trying to address this issue through this study.
Thank you very much. And it's really interesting to hear about the really important role of the nurses in this. It's a different approach, and it's one that's really interesting to hear. I'm going to ask to talk now with Dr. Puja Chatterjee. So she is a young doctor working in training. How has it been for you in terms of integrating this project into the hospital? I mean, you work in an area that is very poor.
Yes, in NuGenA, my role has been more like a manager, integrating and organizing. It is the nurses who spend the majority of the time with the patients. The patients open up to the nurses more than they ever will to us as clinicians. It is difficult for most of the patients to understand the implications of having a hereditary cancer, especially when they are still coming to terms with their own cancer. After the motivation and the counseling part is over, everything then boils down to the cost and the out-of-pocket expenditure. Our hospital pays for a major portion of the treatment cost, including diagnostics. Convincing people to pay for the genetic testing is difficult, especially because it is their out-of-pocket expenditure. Yet we've had interesting, encouraging results from the women from our general cancer screening camps. We expected it to be a taboo, but women in general were interested after coming to know the implications for genetic testing. Coming to the numbers, when 14 patients are counseled or given information regarding NuGenA, 10 show their eagerness to participate, but however, only 5 end up getting tested. We are still hopeful that the rest who have shown interest will eventually come and get tested. The cost of getting the genetic test is approximately $200 US. This is the usual subsidized rate for the government hospitals. Under NuGenA, they get to do the test below $100. And we ask the patient their willingness to pay or co-pay as much as they can, while the rest gets supported through research funding. When given an option, given this option, 5 patients have undergone testing at subsidized rates, while 1 agreed to pay the full amount. People have questioned the value and worth of a test when it is given to them free of cost. They think, like, what is the catch behind the free test? The attitude becomes suspicious towards the free test itself, hence the importance to move away from incentive-based approach. Willingness to pay is an aspect that we are looking into. We have been talking to the general insurance scheme stakeholders to include this cost within their total expenditure list, treating genetic testing and counseling in the same way as any other diagnostic test.
That's really interesting to hear that women are more suspicious when the test is free. I know it's an issue that is under discussion in a number of lower middle income countries about the preparedness and the acceptability of paying for the test. So thank you very much, Puja. And now I'm going to turn to Dona Chakraborty, who has been a patient who has been involved in the NuGenA Project. I'd like to ask you what your experience of being involved has been and why it's been important for you to be involved, what you have learnt from it, and what the team have learnt from you as well. Over to you, Mandira.
In 2016, as a patient, আমার যখন ডিটেকশন হয়, তো আমি আমার ক্ষেত্রে এটা খুব একটা আনন্যাচারাল জিনিস ছিল যে আমি কি করে এটাকে ওভারকাম করব, কারণ কি একটা মনিটারি একটা ব্যাপার আছে, তারপরে আমার মেয়েও তখন খুব ছোট, সেক্ষেত্রে আমার কাছে এটা খুব একটা খুব প্যাথেটিক জিনিস ছিল। তো যখন আমি এদের কাছে গেলাম, এদের এই টিমটার কাছে, এবং এই সমস্ত ডক্টরসরা আমাকে প্রচন্ড ভাবে হেল্প করলো। তার মধ্যে অসীমা ম্যাম আছে, পূজা ম্যাম আছেন, এবং সঙ্গে সঙ্গে সমস্ত নার্সিং এ যারা ছিলেন, যেমন ডোনা, অপরাজিতা আছে, তারপরে সুপ্রিয়া দি, এরা সবাই আমাকে ভীষণ ভাবে বুস্ট আপ করেছেন। এবং সবচেয়ে বড় কথা যে একটা তো মনিটারি ব্যাপার আছে, সেক্ষেত্রে আমাকে যেমন হেল্প করেছে, তেমনি আমাকে মানে মেন্টালি সাপোর্টও খুব দিয়েছে এরা। তো তারপরে কি হলো, আফটার মাই কেমো সার্কেল যখন স্টপ হলো, তখন সেক্ষেত্রে আমি ডিসিশন নিলাম যে আই প্রমিস টু মাইসেলফ যে আমাকে কিছু একটা করতে হবে। তার জন্য একটা আমার প্ল্যাটফর্ম দরকার ছিল। এই যে আমাদের এই প্ল্যাটফর্মটা, এইটা কিন্তু আমাকে অনেক বড় একটা জায়গা দিয়েছে লোককে বলার জন্য। এবং আমি মোটামুটি এখন প্রত্যেকটা লোককে বলছি, এবং কারণ আমি জানি তাদের যে সাইকোলজি, ধরুন যে সার্ভাইভার থাকে বা সার্ভাইভারের যে বাড়ির লোকজন থাকে, বা আমাদের যে এই যে মানে সোসাইটিটা, তারা কিন্তু অ্যাওয়্যার নয় অ্যাবাউট ক্যান্সার, এবং তারা ভাবে ক্যান্সার মানে অনেক কিছু, বা ক্যান্সার মানে অনেক পয়সা। তো সেই সমস্ত কিছু অ্যাওয়ারনেসের জন্য আমার নিজেকে এদের সাথে ইনভলভ করতে আমার খুব ভালো লাগে। তো আমি চাইবো যে এরা আমার সাথে পাশে সবসময় থাক, এবং আমাকে এই একটা প্ল্যাটফর্ম দেওয়ার জন্য অনেক অনেক থ্যাংক ইউ সো মাচ।
Thank you, Mandira. Thank you. Mandira, thank you so much for sharing your thoughts, and it's really interesting to hear how being involved with the nurses and doctors on the NuGenA team is bringing you benefits and bringing benefits to the wider community too. So thank you, Mandira, and thank you also to Puja and Dona and Asima. It's now time for our final session, which is our panel discussion. So if you'd like to click on the link, that will take you to that session. Thank you very much. Bye-bye.